People with learning disabilities are at greater risk of many physical and mental health issues than the general population. Completing this training means that you can be better prepared of how to help a person with a learning disability and reduce health inequalities for them. You will learn what a learning disability is, what the barriers are for people with learning disabilities accessing healthcare, and how to make changes and recognize problems so that people with learning disabilities can overcome these barriers and experience good healthcare. The key things to take away from this training are to think about communication. Does the person have any communication needs? If they do, can you provide information in an alternative way? For example, you could use an easy read format when sharing information by letter. Who are you directing communication at? You may need to speak slower and use language that everybody can understand. If someone is with a carer, remember to speak to them and not just their carer. Remember to check the person you are working with has understood your communication. You can do this by asking for their feedback. Also, think about the environment. Is the environment causing the person distress? If it is there a quieter room they can wait in with calmer light? Can they be seen sooner? Or could they have been asked to come at a less busy time? Is it accessible for people? If it isn't, can you do anything to make it more accessible, such as making more space for them? Lastly, think about your approach. Use simple words, avoid using jargon. Give people the time and space to communicate. Listen to the person and their supporters and ask what reasonable adjustments might help. Making these changes can have a huge impact on whether someone with a learning disability has a good experience with accessing care. And, if we make it easy for them, we can massively reduce the health inequalities that they face.